Guys, good evening. So before I commence this video, I just want to say something. I want to tell you people something that most of you are not really realizing. What you are not really realizing is that in science there are so many disciplines in science, even in the health sciences. So the fact that a person is a nurse or a doctor doesn't qualify that person to give advice on certain fields. And except you know these differences, you can never really tell. All right. So that is the disclaimer I wanted to put out. Then another disclaimer I wanted to put out is that people do content just for the sake of content, just for the sake of likes, comments, engagements. Some of them have monetized their accounts. They do not do content based on knowledge. A lot of them are not even qualified to give that advice they are giving. That is the second disclaimer. Now, a particular topic was brought to my attention. You know, people had been sending me this. I saw it about 2 weeks ago. I think I watched the video, and the people that were sending it to me were asking me who is right, who is wrong. And I remember telling many of them that, look, you know, by the way, the topic is about sunscreens and sunscreens and the effect it has on, negative effect it has on the health. And when they were asking me, I was telling them, I said, look, there are so many different sunscreens, and they are of different varieties. There are at least 30 sunscreens in existence of different types of, you know, class of compounds, which I will touch on, you know, because this is an educational post. And you brought an argument by two people. One person was arguing that sunscreens are bad, and that person, to my recollection, because I looked at the video only once, after I had seen it, I just tuned it out, because both of them were not presenting accurate knowledge. While yes, they had certain points, but it was clear to me that they didn't understand much about sunscreens. And I'm sure if you dig deeper, you will realize that they are not even qualified to give that advice. Now, let me tell you, the people that are qualified to give this kind of advice are what? Pharmacologists. And then medicinal chemists. Not medical doctors. Even though they have access to, you know, the research that has been done, so they can read up research. But when you want to get down to the nitty-gritty, it is the experts that you ask. So now, there were two classes of people. One was totally against sunscreens, and if I recollect, she was saying something that was erroneous. She said sunscreens are bad, and when she was listing the sunscreens, she included sunblocks. Now, sunscreens are different from sunblock. Even though they are similar, they are classified differently because of the different mechanisms of action. I'm going to be putting up chemical structures of most of these things so you can understand. Now, the sunblock, which are different from sunscreens, are examples: titanium oxide, zinc oxide, right? So what these two do is that you put them on your skin, and it reflects the energy, the light energy, preventing it from penetrating. And they are inert. They are not absorbed by your skin and cannot go into your body, into your blood, and have pharmacological effects. So they are safe. The only reason why people don't use them a lot is because they give the skin a white cast. That is, if you put it, if you are dark skinned, you put it, you look as if you rubbed something like white powder on your skin. Whereas the sunscreens are, by virtue of their chemical structure, they have something which in organic chemistry we call conjugation. That is a double bond with a single bond in the middle and another double bond. When you expose such compounds to light, there is a shifting of the electrons, and then when those electrons are being excited and they are shifted from one orbit to the other, they are absorbing the energy. So when you put such chemicals on your skin, they absorb that energy and prevent it from damaging your skin. That is the mechanism. So two different mechanisms. So error number one from the person that said sunscreens are bad. There are sunscreens and there are sunblocks. Sunblocks are not bad because they cannot go into penetrate your skin. Now, there are other factors involved, because she mentioned something too. She talked about reproductive problems. A lot of sunscreens have been linked to reproductive problems. Now, when I finish this video, because this video is going to be too long, so I'm going to put a lot of information in the caption. Read it. When you have something that can pass through the skin and pass through layers of the skin, they can go into your blood and then act, having one effect or the other. Now, a lot of the sunscreens have that effect, reproductive toxicity, because they tamper with your endocrine system, your hormones. And that can have a negative effect on reproduction. As a matter of fact, the benzophenones, which are the most popular ones, have been linked to things like endometriosis. There is clear evidence for that. However, what you need to realize is that, these are chemicals, okay? And I spoke about absorption. When you have a chemical that the chemical structure or the molecular weight is very high, the structure is too large for it to pass. So it isn't all the sunscreens that are bad. That's what I was trying to explain to the people that were sending me DMs. The sunscreens that are okay are the ones that have very high molecular weight that cannot penetrate. Almost all the others are linked to reproductive giving reproductive issues. So for the person saying no, there's nothing wrong with sunscreens and everything, that one too is not true. There are some sunscreens that are bad. I'm putting it in the caption. Read everything about it. Some of them are bad. Some can cause reproductive problems. Some can damage your DNA. Yes, there are some that can cause that are what they call teratogenic. That is, if a pregnant woman uses it, it can damage the baby developing in her womb, causing defects. So it's not that simple. Sunscreens are bad, sunscreens are good. There is evidence that some of them are bad. There is evidence that some of them are good. But like I said, when you want to listen to content on health, please look for the people that are experts. When I say, people think I'm just saying it for saying sake. It is because it is the person that is the expert that will tell you what it is. A nurse is not qualified to give you that kind of advice. Neither is a doctor. Yes, I said it. Because these people did not study the way molecules, chemicals react in the body. Okay? All they study is, what causes illnesses and how do we treat it. I had a friend, let me give you this. I had a friend who was a pharmacist, and a doctor wrote some drugs for a patient and took it to. The pharmacist looked at the combination and said, I'm not going to prescribe this. Why? Because that patient will die. So that's what I meant. The people that are qualified to give advice are the people that you take advice from. And a lot of people are online creating content without in-depth knowledge about what they are talking about. So you use your discretion to know who you will listen to. If a person is a physicist, I've given this example before. If the person is talking about the solar system, etc., etc., you can listen. If the person is a medical doctor and the person is talking about what causes illnesses, yes, he is an authority. If a person is a nurse and the person is talking about how you give palliative care, how you take care of patients, the nurse is an authority. If a person is talking about how chemicals interact with the body, it is the medicinal chemists and the pharmacologists that are authorities in such fields. So when you realize that, you know, this blurring of medical disciplines that most people have in their mind, it shouldn't be. Each discipline has their own specialization, and it is only those people that are experts in a particular field that can really give you the best advice on such topics.